Hi friends, good evening, and this is your host Ankit Kandelwal joining you from Delhi, India, and we have Kimberly Calhoun joining us from North Carolina, United States of America. Good morning, Kimberly. Good morning to the world, and namaste to everyone. And this is 6th of June, Starry Saturday, with wonderful guests lined up today discussing about the best practices. And we'll start with, I would like to invite Dr. Mansi on board to have a discussion about how dental hygiene is as important as other medical practices. Welcome, ma'am. Good evening. How are you?
I'm good. How are you?
All
Oh,
good.
good evening, Dr. Mansi. Welcome to IBM TV. Thank you for joining us.
Thank you. It's my pleasure.
So, explain to us what you do. We know your husband very well, so thank you for joining us. But share with us, because this is pretty interesting to me. You've got quite an interesting family, both doctors and everything, but it takes a lot to become a doctor in dental hygiene, dental surgeon. So, explain to us what you do.
So I'm a practicing dental surgeon. I have my own clinic and I'm a prosthodontist, so do a lot of full mouth rehabilitation and implantology.
Wow. So that's
Yes.
so this but dental hygiene, that's a lot of work in the mouth, and in this day and time with COVID, what are some of the new practices that you're doing? Because we can't stop our dental hygiene. I believe in good dental hygiene because everything that goes in our mouth and happens in our mouth is our health, period.
Yes.
And
The positive thing about COVID is that people have become very aware about the dental hygiene, their immunity, their health, and people are more conscious of what they eat and how it affects their body. So I think that is one positive aspect. But with the dentists not opening up in the recent future, so it is very important to take care of your oral hygiene at home.
yes.
Yes.
True.
But I always count on visiting my dentist every 6 months.
Six months.
And I miss it, right? But give us some tips that we can do at home that really just make good sense. I know we know what to do, but sometimes hearing it again is good support.
So you know what? First, I'll talk about what if you do not do it. What if you have this poor oral hygiene and you don't brush your teeth properly? So poor oral hygiene is associated with a lot of diseases like heart, pneumonia especially with COVID going on. So indirectly, it is affected by your dental health and how you maintain your oral hygiene, pregnancy complications. In case you do not have teeth because of your oral hygiene, people are not able to eat balanced diet. And again, it affects your health indirectly. So to understand oral hygiene, understand 3 points. What is dental plaque, dental calculus, and dental caries.
Wow.
Yeah. So dental plaque is that thin, sticky, yellowish biofilm that sticks around your teeth the moment you stop brushing your teeth. The bacteria start getting activated. So it is very important to brush your teeth every day and 2 times a day. Now, when this biofilm, it hardens, you do not brush your teeth, and then it hardens and gets firmly attached to the tooth surface. It forms a dental calculus. This dental calculus can then only be removed by your professional, your dental surgeon or your hygienist. And then comes your dental caries. The bacteria in your dental plaque, they do not let saliva pool around your teeth. And then the sugars get converted into acids, and these start eating up away your enamel, your dentine, and finally your pulp, where the infection or the inflammation starts. So these three procedures start in case you do not take care of your oral hygiene. So it is very important to take care of it.
It
Now,
is. You say brush your teeth 2 times a day. Are there any particular times we should be considering? Always I wake up and I brush my teeth. But you know,
you brush your teeth so that your mouth doesn't smell bad in the
mhm.
morning. That's a fact. But you brush your teeth twice a day. So one morning is after breakfast, to be honest.
That's
It is
right.
after 30 minutes of eating your food so that the pH level is back to normal in your mouth, and that's when you brush your teeth in the morning. And at night, once you've had you've completed your dinner and your drink, before going for bed, you brush your teeth then and go to sleep. So that's the time that you actually brush your teeth.
And I didn't think that you should wait after you eat. I mean, that's very good advice. I either had heard that once and forgot about it, but no, that makes very, very good sense. I mean, we all get in such a hurry, we forget these little basics, right? And also, flossing is a big thing here. And my dentist always gives me a thing of floss and tells me to remember flossing. But what are some good things too? Our gums are very important, right? And so, should we brush our gums too, or how should we take care of our gums?
So, you do flossing before brushing your teeth. So,
Oh,
flossing, yes, because flossing, it goes into the tight contact between your teeth and you clean that area with your floss because that area, the brush do not enter that area. So, if that area is clean and you use a fluoridated toothpaste, fluoride kind of seeps into that area and protects it further. So, you should floss before you brush your teeth. Flosses can are either waxed floss or you have dental tape, you have flosses, you have interdental brushes. All these can be used before you brush your teeth.
okay. No, and that's something to truly consider. And what are some good foods we can eat that are good for our gums and our teeth? Are there good foods to eat?
Oh yes, apple. Bite on an apple every day, and trust me, you won't need to see a doctor. it is,
Well,
it's, because biting on an apple, it gives strength to your teeth. It self cleanses your teeth. The juices they seep into the interdental spaces and clean that area. So things like fruits, all kind of fruits are very good. Milk has calcium. Eggs and cheese have calcium. They're good for your teeth. Broccoli is very good again. So green leafy vegetables are very good for your teeth.
and these are good for your body too. So, but the apple is just good all the way around. It must be the number one fruit of the world, right? Just
It is. Yes, yes.
and I think that that is some good healthy practices for us. Not just as adults but children too. For children, what are some good tips for them? Because they're growing, they have the baby teeth and they lose the baby teeth, and they have wisdom teeth that are coming in. Maybe you keep them, maybe you don't. But what are some good practices for children?
Uh, See, you have to teach the children to wash their hands before they brush and after they brush and floss. You
Okay.
have to teach them, yes. It is very important to wash their hands before they start brushing or flossing and to include flossing and tongue brushing in their daily practice. We just brush our teeth and we just rinse it and go away. No, we should floss it, brush our teeth, and then brush our tongue also because a lot of bacteria reside on our tongue. It can be either with babies. I would recommend just with your toothbrush, but adults can use a tongue cleaner as well. And teach them how to go round and round with their toothbrushes when they're brushing, and not in a vertical or a horizontal direction. Just go round and round. Not to share their toothbrush with anyone, not their mommies and daddies, not at all. And they should have a separate clean container, open container to put their toothbrush in. It should not be a closed, moist container because then the bacteria settle on the bristles of the toothbrush. So it should be a clean container, and to to keep each toothbrush if they have siblings to keep their toothbrush separate from their siblings. That is again very important. And to replace their toothbrush after every 3 months or immediately after they've been sick. They're down with viral or flu, and then they should replace their toothbrush once they're back to their normal self.
Oh, that is very good advice. And to that I think a lot of children, they get excited, they get in a hurry. A lot of kids don't like to brush their teeth. And then when they get their if they have to get braces, that's when you need to brush them more, right? And everything. So, all right. So share a little bit, because I like for people to learn about what your profession is. What did it take to become a dentist?
It was a good journey, I would say. A lot of hard work, lot of studies, and lot of dedication, and a lot of hard work, actually, I would say, to become a dentist. Yes.
Why did you choose dentist? Is what made you choose to be a dentist?
I had my wisdom teeth removed when I was 18, and that's when I decided I would become a dentist. It was so
What part
painful.
of that experience that made you decide you want to be a dentist?
It was so painful that I wanted to do something to actually, have a dentist, painless dentistry, and that's what I practice.
Wow.
I I try to practice a painless dentistry in my clinic.
I was 21 when I had my wisdom teeth removed, and it was very painful. Yes, it was the most painful. In fact, I thought, this can't, giving birth cannot be more painful than this, because it was
Oh
so
yes.
painful, right? And I got one spot because they removed 5 teeth, because I had another tooth that was impacted. So they removed 5 teeth at the age of 21. I'm very
Okay.
proud, and I might not know this year, right? Because I missed seeing my dentist, but I've only had one cavity my whole life. So I'm real
Oh
proud of that. I
wow.
believe in the brushing, like you say, but sometimes we forget. We get in a hurry, we get in a rush. But
Just take 2 minutes in the morning and 2 minutes at night. That's
I
it.
know you think it's nothing, but sometimes you're just your brain somewhere else, and just trying to remember a few minutes after you eat rather than right after you eat. But anyway, no, these are good practices. So, what do That's a busy job. Being a dentist isn't just cleaning people's teeth or filling them or operating. There are many other things you do in a day to build your own practice. In India, do you have your own practice?
Yes, I have my own practice, and I do minor surgeries with lasers. I am
Oh,
a
wow.
laser dentist, so I practice with my lasers, and we do full mouth rehabilitation, like smile designing. People who do not have a good smile and would want a beautiful smile. We do, we have these digital formats to help us design smiles. And full mouth rehabilitation can either be in forms of veneers or implants. You know, like at the age of 70, if you do not have teeth, you don't want dentures anymore.
Right.
People don't want removable dentures anymore. So implant is a good option for them, and you have good fixed teeth.
What is an implant?
Do you want me to show you?
Yes.
Okay, I have a model here. Ouch. So, can you see?
Yes. Can you put it up
Can
just
you
a little bit closer? And then can you
can you
zoom in?
Yeah, well, okay, let me show you. Can you see now?
Yes. Yes.
Yeah. So these implants are these titanium screws.
Okay.
One. So these titanium screws, they are drilled into the bone. Just imagine this to be a bone. They are drilled into the bone, and then over that you have your prosthesis, your crowns over it. So they look just like your natural teeth, and in fact they function 80% like your natural teeth.
Wow. Probably
Yeah.
better because you have titanium, right? And
Yes.
I like that because titanium doesn't rust. It's very durable, very strong.
Very strong, and they are coated with hydroxyapatite or bone chips, and they kind of get fixed in your bone,
Oh,
and they
wow.
last long. Yes, and if done properly under hygienic conditions and properly sterilization is taken take care of, they last. And
Wow.
you can actually, go back to eating and chewing everything possible you want.
Well, because dentures are not comfortable. They're not.
Then,
They're not. They can be very painful for some people. I know people would get them, but they would never wear them when they eat or anything. So I know dentures can be. So that's just basically reconstructing your teeth. That's just
yes,
like just getting a real tooth, not dentures. So you said
yes.
laser surgery. Now, this is my last surgery for anything was back in 1982. So it's been a long time. Explain laser surgery for mouth.
So, okay. Now, lasers are, adjuncts to your minor surgical procedures. So they are basically uh, lasers, though they are bloodless procedures. Like for your impaction, the surgeon must have put one incision with a blade, and it must have bled a lot at that time. So lasers, they have bloodless. The patient does not experience pain when we are doing the procedure, and it is over in 2 minutes.
Wow.
It is so fast. And moreover, I do lasers for people like who have pigmented gums. They have those black or brown gums, and they don't want it. They want those pink, shiny gums.
Hmm.
So lasers, they just kind of peel off that pigmentation over it.
So
And
what is the
and
black
now with
gum?
focus. Yes, sorry.
I'm sorry. Yeah, no, and I interrupted you. I'm sorry. What is the
With
black gum? How does it get black like that? Why does it?
those are natural pigments.
Okay.
Like you have your skin color, which you
Hmm.
can't get away with. The same way, even your gums have natural pigments, and they have this is melanin pigment. So some have more of melanin pigment, and some have less of melanin pigment. Moreover, with COVID happening, so when we use our eroters, if you visited the dentist, a lot of aerosol is out. Lasers, you don't have any aerosol. So you can actually prepare the whole cavity with your laser, and there'll be like minimal of aerosol eruption, and you have high vac suction right over it. So, that's a kind of help.
Wow, that is interesting. I would be interested in just seeing a procedure done. That sounds so cool. But technology has allowed you to do all these great and wonderful things painlessly, right?
Yes, yes.
Which is why you got into this, right?
That's why I joined dentistry. I didn't want anyone else to experience the pain.
And that's why I love to hear people's stories because there's always a reason, a purpose, and a passion, right? And you
Yes.
definitely have it. So, how many years have you been a dentist?
More than 13 years now. I finished my postgraduation in 2006,
Wow,
and
congratulations. Yeah.
thank you. And
Yeah.
I've been practicing since
So,
then.
Ankit, do you brush your teeth every day?
Yes.
I can tell he's got a pretty smile, doesn't he? He's got a real
Oh,
pretty.
he has. Yes.
I can tell he brushes his teeth probably twice a day, right, Ankit?
In fact, Kim, I in fact brush whenever I have to talk to a doctor, especially a dental surgeon. I brush my teeth before calling them.
Before calling him too. you know, sometimes little kids they don't like to brush teeth, right? And as my niece got older, she used to fight. You'd have to just fight her. I know she's going to hate me for saying this, but to get her to brush her teeth when she was little. But then when boys started to become like she was interested in boys, she would even brush her teeth before she would call them. Oh my gosh, we had to fight you to brush your teeth to go do anything. And you brush your teeth before you get on the phone now. I just thought that was funny. But yeah, but the thing that people don't understand is many diseases like heart disease come from the mouth, right?
And pneumonia. A lot of, yes, pneumonia, diabetes.
Diabetes.
Yes, they're all closely related to your oral hygiene.
Wow.
Cancer can be detected in your oral cavity if you visit your dentist regularly. Research has shown that cancer can be detected.
Oh.
Are there particular things that are really bad for your teeth, like fruits, like maybe because I was always told lemons or things like that. But are there anything in particular that can be bad for your teeth?
Uh, Sugary, chewy things. Those candies. Those candies. Oh my God! I know they taste well, but they are the worst thing that man created. They really, really love your teeth also because they stick onto it and then they just don't go away. Lemons are very good as long you don't suck on it.
Okay.
The moment you start sucking on lemon, that because lemons are acidic, any vitamin C is very acidic. So that's when it starts eroding your enamel on your tooth surface. So
Okay.
sugary, avoid Coke, aerated drinks.
I was
They
told that. Yep.
yeah, sodas, they erode your enamel and they really wear it off.
Yeah. And my family.
Also,
Go ahead.
I mean, people do a lot of brushing every day. I mean, maybe twice or thrice a day. But there is a process of how to do a brush, yes, because some people just do the brushing and then they just, I mean,
What's on
it
that?
brings out. So
So
you need to,
I can
yeah,
I can show you how to brush. You want me to show
Okay.
you how to brush?
Yes. Yes. That would be great.
yeah,
Okay. Okay. So can you see? Okay, let
Yes.
me see.
Yes.
Can you see now?
Yes.
Okay. So just imagine this to be your jaw and you have your toothbrush here, right? Now
yeah,
understand that this head should be small or big enough to go to this your last tooth. Your last
okay,
tooth should be able to clean properly. So it should be small enough. And the
okay,
bristles should be either soft or medium.
okay,
So once you've rinsed your bristles and applied toothpaste over one third of it, only on the blue part, not the whole surface, just half of it
okay.
maximum.
Mm.
Just go here.
Can you
Can
lift it
you
up? There you go.
okay? Can you see now?
Yes.
Yeah,
Yes.
you can.
Angulate, yeah, angulate your brush to 45 degrees. Okay,
Okay,
go on your last two teeth, go round and round, and then
okay,
horizontally up. Round
okay,
and round, go horizontally up. Round and round, go horizontally up. Similarly, round and round, go horizontally up. For your upper teeth, go round and round, horizontally down. Round and round. So you have to angulate it down to 45 degrees.
Okay.
Then you open your mouth and can you see now? Yeah.
yeah,
Angulate 45 degree, go round and round, horizontally up. Round and round,
okay,
horizontally up. Round and round, horizontally down. Round and round, horizontally. So you basically the motion is round and round and not like this,
yeah,
vertically. But with your front teeth, upper and lower. Front teeth inside portion. You see
okay,
inside portion. You have to go vertically up and vertically down.
okay,
And then on the top surface, you go round and round, and you're done. And you rinse your mouth, and you're done. And then you use your mouthwash. You floss before you brush, and then you brush, and you use the mouthwash as suggested by your dentist, and you're good to go.
Yeah, and it's not that easy bad to do. It's very simple. Just simple little brush,
Round and round. Yes.
round and round.
You,
They've got those
round and round.
electric brushes, but I'm not too crazy about them. So I still like to use the old fashioned. I'm going to share a little secret with you. My family sometimes they're not too crazy about my gifts, but we have a big event called Halloween in our country. I don't know if you're familiar with it, but it's a lot of candy, right? So
Yes.
I would get from my dentist, I would pay for them a whole bunch of toothbrushes. And I would give candy too. I would give candy, but I handed out toothbrushes, and we would also host because a big party at Halloween, and I have a big casket, and I would fill it with candies and toothbrushes, and toothbrushes at Christmas. I would always give out toothbrushes, but I cared about
That's
people's
nice.
teeth. I cared about their teeth. I know they didn't like it, but
That's
I
so
thought it was a
sweet.
gift from a heart, right? So we
That's
have
so nice.
guest, Rakesh from Hong Kong and
Hi.
Jim from San Francisco.
Hi.
We
good
have
evening.
You guys know Dr. Gupta, and this is his beautiful wife, Dr. Mansi Gupta, and she is a dental hygienist surgeon. Or dental surgeon, and we've had this lovely talk about keeping our teeth well and the importance of it, especially during COVID, right? Maybe if we all followed this practice even 3 times a day and rinsed real good, maybe if we had COVID, it goes out. We don't know, but right, it can't hurt. But do you guys have any questions about dental?
Yes.
Okay, Jim, welcome.
Yes, I was fascinated, and Dr. Gupta, I noticed that you're referred to as an aesthetic dental surgeon, and I was thinking anesthetic when I first saw it, like painless. And so, but aesthetic means to me, beautifying or beauty, and so I was thinking, it's no wonder you've married a plastic surgeon, because he must be an aesthetic surgeon. But what does aesthetic mean to you in terms of dental surgery?
So first, I've married a pain specialist. My husband's a pain specialist.
Jim, you are confusing with Dr. Tula, because Dr. Tula is a plastic surgeon and Dr. Gupta is our pain management specialist.
Got it. Sorry. My bad.
And yes, and coming to the second question, aesthetic means beautifying. So I actually give smile back to the patient, like full mouth rehabilitation, smile designing, models who want a perfect smile from premolar to molar, or full molar to molar smile. So I design all that, and I make sure that how much teeth is visible when they're smiling, or what should not be visible when they're smiling. So I design all that, and then that is full mouth rehabilitation. Yes.
Thank you very much. I understand now. My other question about this is that I do, although Kimberly doesn't like them so much, I do use an electric toothbrush, which has that round to round motion that you're describing.
Yes.
I don't do this downward motion that you were describing.
Yes.
Should I?
I would prefer that you do. So the electric toothbrush, you kind of just keep it, it just covers either 1 or 2 tooth surfaces. So once you're done with that, you have to push all the debris down in your mouth when you're doing the upper teeth, and when you're doing the lower, you have to pull it all up. So you have to get that motion in the end. Yes.
Yeah, that's very interesting to me. And Rakesh, excuse me, I have one more question. I don't mean to hog all the time, but I had fillings in my molars when I was a teenager, and my last dentist was getting near retirement age, and he told me I'm having some trouble with them, but until I have pain, we'll not worry about it. And so the new dentist came in with all brand new technology, and he looked at them and he said, these fillings have expanded, these silver fillings have expanded, and they're causing cracks in your teeth, and decay is settling in them. So I've had a long series of dental work now to repair them, including crowns. So my thinking was, is this new technology allowing us to notice things that the old technology did not?
Yes, that is what technology advancement is all about.
Right.
So your older fillings were amalgam fillings, so there were silver fillings or amalgam fillings. But with advancement, we realized that they are good, but they have their bad points also, like amalgam poisoning in the mouth, and they kind of build internal stresses in the tooth surface that causes those cracks in your teeth.
Right.
So, and with the new fillings, these resin materials. The composite materials are resin materials, and they have their own plasticity. So, excluding the bad points of resin fillings, they are more aesthetic and more functional. So that is a good thing that you got them changed.
Yes. Thank you so much. I've learned quite a bit already.
Yeah.
Thank you. My pleasure.
But these are good things we should be reminded of many times, and not just and sometimes we don't get it when we go to get our cleaning done at the dentist office, right? They're just there to do their job, and they might say a few things. Oh, you built up a little plaque here, or they just started a rating thing now. So now I get irritated if I don't get my rating right. So, so I'm like, I'm
by
going to
number.
beat it next time. I'm going to beat that rating next time. And then but I'm glad they're there to make sure, because I don't get it right all the time, right? And that's the good. That's why dentists are very important to go to all the time. But she makes sure that if you don't have all the right things, she makes sure you have all the right things. Like you've got the bridges or the teeth, or fixing things that are broke that doesn't like you said, make your smile again, right?
Rakesh, I think it's your turn.
Yes, Rakesh.
Yeah, I've just a very, very tiny question. It's about when you put a crown. I remember when I did, I had a couple of crowns on my teeth. When I did it in Hong Kong, they didn't do a root canal before they put a crown. But when I did it in India, they did a root canal before they put all the crowns. So I was just wondering, what's the appropriate sort of, or what would you, in your opinion, think is a better option?
So now that depends on the condition of the tooth and what type of a crown are we going for. See, if there are certain criteria that we have to see before giving a crown. Now, if you have a dental tooth decay, it's a decay and it's a big hole in your teeth. Filling sometimes does not stay; it just fractures. So you give a crown. But if the crown is in such a way that you are sure that the filling will go in for a root canal, you could do a root canal and give a crown. Now, if you are going for a bite raise, you're just raising the bite, and then you don't usually do a root canal. So it all depends on what the condition of the tooth is at the time you're giving the crown, and what material are you using. Now, material in the sense, if you're using a stainless steel crown, you don't need to prepare the tooth that much. So we don't usually consider. But if you're going for a ceramic crown, you need to prepare the tooth for at least 2 millimeters.
Yeah.
So those are the criteria that we think about before asking the patient to go for a dental root canal. Not otherwise.
Both were ceramic crowns, but the doctor in India just said that I need to do a root canal, as if it's just always done. So when I did one in Hong Kong, and usually it's when I've got a cavity, so the doctor decides whether to put a crown or not. So the one in Hong Kong didn't do it. He just he said there's no need to. It seems if you do a root canal, you sort of kill the tooth, something like that, So
yes, it does.
So
it depends on why you were getting the crown. Whether you were getting the crown because the tooth had a cavity or for any other reason.
There was a cavity, basically.
The cavity must have been deep enough for the dentist to go for a root canal.
Okay.
That's interesting. Go ahead, Ankit.
This is a basic question for all the viewers, and a lot of viewers are watching us around the world. And the question is, how soon we have to change our toothbrush?
How often?
Every 3 years.
Okay. So it is advisable to change the toothbrush every 3 months. And like I said before, after every time you fall sick. If you have flu or a fever or anything, it is always advisable to change your toothbrush once you get fine. Otherwise, every 3 months.
Okay. And also, whenever we brush our teeth, people tend to use too much amount of toothpaste as well. So, what is the right amount of toothpaste we need to use?
So that I showed you. So you should use either just on the blue portion. If your tooth do not have that, otherwise 1/3 to 2/3. That's it. Not more than that. Yeah. So till here, say about maximum should be till here, not more than that. You don't have to apply on the entire bristle area.
Okay.
Wow. So that's why they put that color there. These years. Okay. So I do, what is your opinion on teeth whiteners? It became a big fad, or the electronic. What is your opinion on that?
So it's like about having your face bleach done. So it is a very individual thing, I would say, that some people really, people who are very socially active, they want their teeth to be white. So
Yeah.
it does have a good effect for a 6 months to 1 year time. But then you need to have those touch-ups done after a year.
Is it safe?
But
Do you feel like they're safe?
with my experience, I feel that patients tend to develop sensitivity over a period of time. Yes, because it does affect your enamel, and it's done regularly. If done like for your wedding or you are going out for a holiday is a different matter. But if it is done regularly, it does harm your teeth, I would say.
Wow. Okay, that's go
Dr.
ahead.
Yes.
Kimberly,
And Dr.
Yeah.
Mansi, we have a lot of questions from our viewers asking about dental spa and a lot of other things, but I think due to time shortage, we can wrap up this segment, and we would like to invite you again on IBM TV.
Absolutely. Would love to have you
Thank
back.
you.
Yeah.
Thank
And
you.
thank you for joining us. It was a lovely
Thank you
conversation
so
and
much.
very interesting insights about dentistry, which no one knows basics.
Thank you so much.
It's
Thank
a
you. My
pleasure
Thank
meeting
pleasure.
you, Dr.
you.
Mansi.
learned a lot. I learned a
My
lot.
pleasure.
Thank you. Take care.
Thank you.